So thank you very much for the invitation to come and speak to you about what Scotland's doing for the Don't Delay Connect Today campaign. Today I'm going to take a small snapshot of a project that we are running to try and widen our audience and to try to make our campaign more interactive. But in the breakout session, we're also doing a lot of rural engagement. So if anyone wants to speak to me about that as well, I'm more than happy to discuss that as well. Slow down. Sorry. Scottish people speak very fast. So today I want to talk to you about the use of interactive augmented reality as a tool for the EULAR Don't Delay Connect Today campaign, and this was run in collaboration with the Glasgow School of Art. I've got no disclosures and feel free to take pictures. So when delivering the campaign, we came to three conclusions: that the general population in Scotland either thought disease didn't affect them or that they were too young for disease. By the time we could convince them that its joint health was important, getting them to understand the route to diagnosis could often be complicated, and then thinking about the treatment strategies and the actual pathophysiology of disease was also complicated. So we wanted to find an easy and interactive way to try and break down the concepts of the campaign and deliver it to the people of Scotland. So to do this, we got the help from the Glasgow School of Art, and one of their master's students designed interactive augmented reality posters. So in the poster you can see here, what we were trying to achieve was to get people to understand that disease can affect them at any age, and to try and make this message more personal to themselves. So in the first poster, you can see there's an area you can place your hand. If you place your hand in the poster, and then you put a tablet over your hand, it overlays a skeleton of what would happen if you had a disease like rheumatoid arthritis and ignored it, didn't get it diagnosed and didn't get it treated early. So here what we're trying to do is capture people's imagination that actually this is a really important message. You need to do something early, and you need to actually take care of your joint health as well as other forms of health. So we then went on to design a series of several other posters. So several outline the main concept of the campaign, so the symptoms to look out for in early diagnosis. We then also have a full skeleton, which when you again use the tablet, pops out, and he gives you lots of extra information. So we've got basic information on the poster, but if people want more information, they can get it from the tablet. And what this hopes to do is to prevent cognitive overload. So if we go out and give people loads of information at once, they tend to switch off. If people can build up slowly by tapping on bits of the skeleton to release more information as they're ready for it, the chances of them retaining it is a lot higher. We've then got a poster which went into more detail about joint anatomy and how joint degradation can occur in different rheumatic conditions. And finally, we wanted to break down the concept of autoimmunity. So you can see in the poster in the far corner that we've got some immune cells drawn in the poster. What our talented master student has done is managed to make them all pop out of the poster, and each of the cells will show you what other immune cells are talking to, but you can also click on them and they'll tell you more about what their role is in health and disease. So we tried out our new public engagement posters at the Glasgow Science Centre, and we collected data from our participants to see how well they were received. What we found were the most common age group to come and chat to us were between the ages of 25 and 34, which we thought was really nice because the idea that rheumatology conditions don't really affect younger people is still quite a strong idea in the general population. So it was really good that we had this age bracket come in to engage with us. And we found out that the younger you were, the more likely you were to have used augmented applications before. And almost all of our participants found the application easy to use. What else did we find? We found that almost everyone learned from the application to some degree, and most people learned about either RA or just generally about the human body, but also 81% of our respondents knew more about the symptoms, causes and diagnosis of rheumatoid arthritis by the end of their encounter with our posters. One of the outcomes that I was very pleased with from using the posters, people got the idea that this was an important concept, and also felt that it was important to let their friends and families know about the risk and symptoms and diagnosis for RE and other rheumatology conditions. And that was 55% of our participants responded positively towards passing on this information. So, in conclusion, our application was well received, and almost everyone gained knowledge by using the application about rheumatic conditions, and they wanted to pass that information on. So, as a pilot study, I feel this was very successful. What I now want to do is look at long-term retention of the information to see if augmented reality has an impact there. And we're now moving on to use augmented reality to try and educate about fatigue so that we can incorporate the time to work concept and the barriers that fatigue can cause to patients with rheumatic conditions as well in the future. So that just leaves me to really thank Tamia Koza, who's actually done most of the work for this project. And thank you all for listening.